Does Omicron stay for longer in the atmosphere? How effective are vaccines against it? Should we go for double masking again? Is lockdown really a solution? All of these FAQs about Omicron will be answered by two of our experts in this video. I'm Arun Singh, a very warm welcome. We have with us Dr. Romil Tikku, Director Internal Medicine, Max Healthcare, Dr. Ravindra Mehta, Chief of Critical Care, Pulmonologist, Apollo Hospital, Bengaluru.
Well, it is worrisome given the fact that this virus can be very devastating. We've seen in the second wave what happened in India. And because the way it's spreading, it's almost becoming the dominant strain in UK and even in other parts of the world. And now we have 40 odd cases in India. So there is something to worry. Just because we have minimal cases right now doesn't mean that we have to get complacent. So we have to be proactive. We have to increase our surveillance. We have to have restrictions in place. And most of all, genomic sequencing has to be done. Travelers who are coming from abroad, we have to keep a track of them, their contacts who are turning out to be positive. And all of us have to actually participate in this and make sure that this doesn't spread further.
Right. One thing we should be worried about is that the way it is spreading like a wildfire. But Dr. Mehta, is there anything that makes you feel relieved about this variant? Is there any good that we see in this new variant?
Yeah, so roughly around, I think, 3 weeks down the line, when we're looking at the information coming in, much as Dr. Tikku points out that we can never lower our guard, it seems to be milder than what we anticipated. I mean, if you look at the construct, they talked of a complete 30+ mutation in an important part of the COVID virus genome. So we suddenly thought, my God, nothing is going to work against it because this is a new COVID-19. Maybe we should call it COVID-21 or something like that. But on the other hand, at least the clinical data on the ground from South Africa, 65+ countries in the world, show that it is infective but mild.
Of course, and when we talk about the death which has happened in the UK, of course, there's no data available on whether that person was vaccinated or not. Dr. Tikku, but many scientists are also fearing that this might outdo the vaccines that we have at the moment.
Well, we don't have enough data to say that, but yes, there seems to be some sort of data which says that the vaccines might not be that effective against this particular variant. But mind you, vaccines don't prevent you from getting infected, but then you won't have severe disease or you might not need hospitalization. It will still give you some sort of protection. So vaccination is the key, and I'm sure the ones who've been fully vaccinated won't have that severe a disease. So vaccination should be the key going forward from now.
Yeah. Okay. Before I go on to questions that have come from audience, last quick question from my side. Do you see lockdown as a possibility or as a solution at all? I mean, based on what we've learned in the past. Dr. Mehta, first to you, and then I'll quickly have an answer from Dr. Tikku as well.
Yeah, so looking at a database or a track record based, or what should we be doing? Lockdowns clearly don't seem to be helping a lot. The only role left of a lockdown is to stem the tide and allow your infrastructure and healthcare to be prepared if the speed of the spread of the virus is more than you have prepared for. Having said that, we should be much better prepared now. 1.5 years down the line, all our preparation from testing to healthcare should be much prepared. People are vigilant. We know there is a vaccine. We know that so much needs to be done. So I think lockdown, though used as a fearsome and a threatened word, will not find a lot of takers at this point, whether it's public or the government or the world at this matter. And in other countries have completely given down on lockdown. For example, in the US, the schools never shut down. So that sort of thing would be the lockdown part of it.
Well, I don't think lockdown is the solution. It served its purpose in the past. But it just gives you a window so that you can ramp up the infrastructure and to break the cycle of infection. But as of now, if you look at the numbers, we hardly have 5,000 odd cases as of now. But who knows about the future? If the numbers go up, they go out of hand. Then you have to at some point think about it, but not at present. It doesn't have any role at present. Right now, we should be focusing on getting things in place, maybe have enough hospital beds, oxygen supplies, drugs, and vaccination. That should be the focus. Lockdown is not something that we're looking at as of now.
Sure. Very quickly, questions from our audience. Hardik Jain asked, any findings if the variant is more dangerous for a particular age group, Dr. Mehta?
No, not yet. Fortunately, not yet. We are worried because we feel that the elderly and the immunocompromised are going to be more susceptible. The vaccine will run out in them. But as of this point, there's nothing to suggest that it is a concrete matter on the ground that we should be worried about this particular age group.
Okay. Dr. Tiku, to you, Harshihra asked, are these symptoms same or different? If different, then what are those? I think that's very crucial because what has come across is that symptoms are quite different from what we've witnessed during last waves or variants.
Well, symptoms might not be different. They might be mild. You'll still get the same symptoms. It's the same virus. It's just a variant. So fever, headache, body ache, cough, cold, all those GI symptoms, vomiting, diarrhea, but the intensity would be much lesser. The data that we have right now says that the disease seems to be mild, but mind you, we don't have enough data on this. But the intensity would be lesser, but there won't be any different symptoms. That would be my take on this.
Okay, but the initial, I think, reports coming from South Africa suggested that it doesn't have to do much with the nose, and it's more about scratchy throat.
There were reports suggesting that it's more of mild fever, body ache, headache, but then it varies. When large number of people get infected, then the symptoms will also vary. Initially, there were reports, but we won't go by that. In the next 2 to 4 weeks, we'll know more about it, the behavior of the virus, when more data comes in. Right now, it's too early to comment on this.
Okay. Does Omicron stay on surfaces or in the atmosphere for longer period of time, Dr. Mehta?
No, nothing to suggest that it's any different from the others at this point. The infectivity seems to be an intrinsic quality of the virus. It's not that it's basically, we have to be very careful about more sanitization, more openness, and so on. So I don't think we need to revisit that. After the first few months, we've realized that that has hardly any role to play. WHO even took off this massive sanitizing of protocols, which is still going on in several parts of the country and the world. So nothing at this point to suggest that. If I can add one word, it is basically individual COVID responsibility or collective COVID responsibility, which is actually required when you watch out for doing whatever is correct to prevent the spread of the virus for what we know right now, rather than pontificate about what else we can do.
Right. Last question to you, Dr. Tiku. Will double masking help in preventing the spread of Omicron?
Because post-Diwali and lots of gatherings happening now and lots of weddings, there seems to be some sort of spread happening. So masking is very, very important, I would say. And double masking gives you just another level of protection. So double masking is the way to go, and follow all other protocols that the government has laid in place, because that's the only way. And be very aggressive with your vaccination. If you haven't been vaccinated till now, go for it. It's the only thing which actually protects you from getting severe disease.
Thank you so very much, both of you, for joining us for this conversation. This is Arun Singh for NDTV.